Oh, I think I did it. Okay. Welcome to Indicio Identity Community Meetup. This month's May is about Cardea, the Next Foundation Public Health Project. Before kicking off, I'd like to take a moment about Indicio. Indicio.tech provides development and hosting services for decentralized identity. Enterprise, consumer, and mobile application runs on Indicio's network and use a comprehensive ecosystem of software to issue, verify, and exchange verifiable digital credentials. This is the meetup to discuss about decentralized identity, and we meet every month. We have different topic every month. So if you have an idea, please feel free to email me or contact me anytime afterwards. Today, we have amazing special guest from Ceta Lab, Gus Piener. And we're gonna have Heather to kick off this session. Heather, please.
Hi, welcome everyone. Thank you, Maya. Terrific to see the turnout here today for our May Indicio meetup. We have Ken Ebert, CTO of Indicio, and Gus Pena, Director of Ceta Labs, who are joining us today for Cardea. Cardea is a new Linux Foundation public health project. Yesterday, Linux Foundation issued a press release about it, and we're holding an Ask Me Anything. But in order to set the stage, we thought we would give you an introduction into Cardea and have Gus talk about the first reference implementation and Ceta's role in helping inspire the project. So Cardea can be found at the website Cardea.app, and that provides all the information about how you can participate in the project as well. Our weekly meetings are at noon Eastern time every week on Thursdays. So to begin with, we're going to talk about Indicio and have Ken kick us off as to why Cardea was created in the first place. And so what I'm going to do is turn it over to Ken to pick up here, and then we'll move over to Gus after that to talk about Ceta's project. So Ken?
So in the world of COVID, there is a heightened concern about privacy and data privacy for people. In an IATA survey, 78% of the passengers who took part in that survey indicated that they would only use a travel app if they had full control over their data. They're concerned that centralized databases or other mechanisms that might not give them the control or consent to hold their data and share it with whom and who they wish might not be in their best interest. So there's a heightened concern there. The public display around vaccination status is threatening rollout of technology, and that could affect the ability to cope with the current pandemic or future pandemics. And this is out of a quote from Bloomberg. The essential aspects of the credential system are that it be able to be easy to implement and integrate with existing systems. If you can't do that, then it's hard to get it deployed and useful. And timeliness is a critical factor in something like a pandemic where you're trying to quickly be able to stem that spread of disease. Interoperability and reliability are also important. If you create a number of silos that don't interact with each other, global travel is a very difficult thing to pull off if we don't have the correct interactions. The privacy preserving nature of it and the enhanced cryptography of the system are also important to protect the data that's being shared. Companies are also concerned with the new liabilities and risks that come with having to deal with medical data and do so in a way that doesn't create a honeypot of credentials within a centralized database for hackers to attack. And for the user side of things, the control and consent part of it is very important to them. They want to know who's looking at their data and what's being done with it. So those are really important aspects of the system's requirements for the system. So Cardea is our answer to that challenge. It's a complete open source system that's scalable for COVID and beyond COVID. I think that many people are focused only on the current COVID application and how it might help in helping government officials to combat the disease. But there are applications far beyond. It's because it's an identity system that is able to preserve privacy and include the user in their consent and control. It can be used for many other applications as well. So Cardea is that complete ecosystem. It spans the health credentials that are coming from the health side of things and all the way through the holder and those people who need to verify, the governments and other types of businesses that might be involved. This is a Linux Foundation public health initiative, and it's designed to be implemented for public health throughout the entire planet. And so that privacy preserving system is adaptable to many different governments and organizations around the world, and hopefully does that in an interoperable way to promote the usefulness and lower costs for everyone. The technical part of this is that we're dealing with a set of verifiable credentials. Verifiable credentials are very useful because they provide a mechanism that a issuer or whoever's signing the data can put it in a form, sign it, and hand it to the holder of the data, the subject of the data, the identity owner, the traveler, the patient, whoever's receiving that data is able to take that verifiable credential and then use it where they need to. They can present that to a government health official, a business venue, all of those types of places, but they do so in a way that's cryptographically verifiable. The keys that the issuer uses, the public keys, are put on a decentralized identity network, a blockchain, as it were, or a distributed ledger, so that they can be picked up by the verifiers to do the cryptographic computations to assure themselves that the data has been signed by the issuer, that it hasn't been tampered with by the holder or anybody in between. And so they can say that that data has been accurately transmitted. Then they can make a business decision on the contents of the credential and say, yes, your health status meets our requirements, and be able to allow a person to enter their country or their business or whatever decision they need to make. The agents involved in this ecosystem are a health agent, an enterprise or cloud type agent that is able to issue that health status credential. That could be a negative test or a positive test, whatever the test results are. It could be a vaccination. Those are the two types that we've considered so far. It could be something like, I've successfully recovered from COVID and I have natural antibodies now. But those health status credentials, whatever they are, can be presented or given to the holder, this mobile agent, and they can carry that with them wherever they need to and present that to, in this case, a government agent, which represents the health department in the first implementation. They present that health status credential. The government reviews that according to the rules of what is considered good health practice, the latest science. And they say, yes, that meets the acceptable standard. And they can issue a trusted traveler credential back to the traveler. The traveler can then use that trusted traveler credential and present that to any business or any other place that they wish to gain access to a restaurant or a tourism location, a sports venue, wherever they need to present that. But they're presenting something that says the government looked at my health data and is certified that I meet the requirements. And now, without presenting any health data to the local restaurant, which I really don't want to share my health status, my details of my health conditions with them, I can present to them that trusted traveler credential, and they can know with assurance that I have met the criteria established by the government. These agents are all based on the Hyperledger Indy network initially. That gives a a place for the public keys of the issuers to be recorded so that the verifiers can rely on those. They can also pull the schemas and the other information they need to do the computations necessary to prove that the credentials have been signed by the issuer and not been tampered with. This basic system of agents, these are reference agents, could be modified and adapted as needed for a particular vertical. Ceta's initial implementation is focused on international travel, and those are the agents that they've built and deployed. The other verticals might find different uses. Employers could use these same types of credentials to say, provide access, assured access to employees to a factory. But the basic agents are the same, and the credentials, the health status credentials are the same. And therefore the system can be easily modified to suit many different vertical applications. So the Cardea system is involving the user because they're the ones holding the credentials, and they provide the consent when sharing that personal data. The benefits to the different companies, especially or countries that are have strong need for tourism revenue and or healthy ability for people to interact, are benefited as well. And it speeds up that reopening of many of these venues. The security system allows for privacy by design and tamper evident credentials so that the instances of fraud are greatly reduced and the public health benefits are realized. The efficiency of this is automates some of the tasks. So in a typical wallet interaction, the connection is a separate step from the presentation. And in the Cardea system, by using gold codes within the protocols, we're able to combine some of the steps. There's also the ability to configure some of the sharing to be more or less automated so that the user can control which things should be done in an automated fashion and which things they want to consent to every time. Because it's a distributed system, it scales easily to millions of participants, including like the employees or travelers and residents. And the rights to the ledger are just the public keys. So you're not, for every transaction, having to write something to the ledger. You're simply reading the public keys off of those at verification time. So the interaction is highly scalable. And the system we've done so far in Cardea is looking at digitized health information. We're not trying to deal with paper credentials at this particular time.
And so Ken, what I'll do is I'll turn it over to Gus to talk about SITA's involvement with the trial in Aruba. I'm really happy that Gus can join us today for this meetup because Gus is the visionary, the original person who created the project. He was our fearless leader, mentor, coach. He filled all the roles in helping bring this particular trial to a successful conclusion in Aruba. So I want Gus to talk with us about his vision, how this verifiable credentials works in the travel ecosystem, and a bit about the experience with the Aruba project. So Gus, I'll turn it over to you. I do have the 2 videos queued up when you're ready to play. I have the animation video and also the video that Ceta released yesterday. So Gus, it's all yours.
Yes. Yeah, so first, I mean, I'll address the connection with healthcare and travel, right? So I mean, there's always been a component of health when you travel, particularly international, yellow fever cards and other things like that. COVID, has clearly complicated that, and I think, unfortunately, like we now have to take off our shoes and put our liquids in little bottles. It's going to set the precedence for a new normal moving forward, right? So our what we've been trying to achieve for a number of years now is how can we streamline the travel journey, right? It's a pain today. you have, we inconvenience everybody every step of the way because we trust nobody. So how can we really streamline and get rid of all these checkpoints and things throughout the entire journey? And now with COVID, it's not just at the border to get into the country. It's now to get to the Olympic event, to get into the casino. There's all these additional complexities added to it, right? So that's the connection there. So the opportunity we had in Aruba is to work with the Ministry of Health to map this out, right? So, there's obviously lots of open questions about privacy and security and all kinds of things, is to really just to push through that and say, let's understand the needs of both the government in enforcing COVID protocols and kind of the needs of the businesses on the island and the passengers or tourists, and how do we create a safe environment where we can ensure everybody on the island is COVID free and nobody's breaking the rules, right? So, the idea is that having a trusted traveler credential that really is your key to go about the island, but that's really a trust. A trust status that can be derived from many things. Have I been tested? Do I have the right test? Have I been vaccinated? But in the long run, there's am I a criminal? Am I a terrorist? So there's a lot of things that could drive that trust factor in the long run. So it's really about telling the government, I want to travel to Aruba. Understanding the requirements. In this case, it was testing, but vaccinations is coming, and that they can make that assessment, at that point in time, and grant you the trust status that now really the venues, the hospitality staff at the hotel, just that say, well, the government says that that this person's okay. Not have every individual have to now say, it's this kind of test or this kind of vaccine, is that following the protocol? But also, it's a dynamic environment, right? Because there's mutations. So the protocols aren't static. So, the hospitality staff have to now keep track of those changes as they go. So this idea of verifiable credentials and decentralized identity solves a lot of problems and sets a really good foundation for this idea of bridging these trust silos, and letting me have fun within a bubble, and feel safe about it. So hopefully that says why is Ceta that's in travel and transportation interested in health and what we're trying to achieve in the long run, but address some issues that we see are in the forefront right now.
Would you like me to play the video that just that shows?
Yeah.
The first video is the animation. I'll play it here. So I think, Gus, what's interesting about this video is it really breaks down the 4 roles of this ecosystem. Maybe you can talk to us a bit about bringing this ecosystem together and how we were able to go from the 4 parties involved to the successful trial in Aruba.
Yeah. So, I mean, obviously, we had this vision. And COVID, accelerated the need to get this out. I mean, I guess our philosophy, in the Ceta lab is, we get a lot farther by learning from doing, so it's a little bit analogous to jumping off the nest, and and the pressure as you start to see the floor coming at you, kind of you figure a lot of things out quickly, and but it's not exactly that crazy. You try to control the things that we know could be disastrous, and test, and learn from that. So obviously there's a lot of pieces here. There's emerging technologies that we aren't that we know we need to solve some problems that we're not experts in. So that's where Indicio came in. That we knew that because we're dealing with healthcare information, I guess we were going to get the rubber glove treatment, and there was going to be a lot of concerns around privacy. So we brought in the HIE in New York to help us understand what the implications are of that, and we actually had quite extensive number of reviews with legal teams, both on our side, Aruba side, and third parties, just to make sure that we were really complying with laws and regulations and ethics and that kind of thing. But the key thing where we learned a lot was from the Aruba government, and they really were open to saying, okay, these are really what we're trying to achieve, what our requirements are, and this is why all these other ideas that we've been approached with aren't working. That's where we were able to shape this into something that addressed all the needs of the stakeholder. And so it was really about putting that community together to really understand what was trying to be achieved, and then what can we do as a first step that that proved that this would work, and actually test it in the real world with real tourists in Aruba, all getting through all those hurdles. I think we answered a lot of questions that in terms of how do you do this safely and securely and while preserving privacy. So yeah, I mean, hopefully that answers your question, Heather.
Well, I'm going to ask you another question here is, what was the biggest question you had going into this project, and what was the answer that you learned?
Well, we had a lot of confidence in this technology, but there's having confidence technically, and is it going to pass the legal mustard and the regulatory mustard? So that was really the question. So it's actually putting it to the test with people that are going to pick it apart, and being able to get through that and address and educate them on how we address those concerns. I would say for me that was it.
What do you think, and I open the floor to those joining us today for questions as well, but what do you think was the unknown that came out of this that you didn't anticipate going
in? How complex this would be to how to align all the planets to make sure that we can achieve something that actually added value to all the stakeholders. So it wasn't just about satisfying the Ministry of Health, but it was also addressing the concerns and questions from these venues of how do we create safe spaces so we can start to open up the capacity in these venues. So it was it wasn't easy, I guess it was, I expected it to be hard, but I don't know that I expected it to be this complex.
And I
Let me
was
let me throw in a couple of comments there.
Yeah.
I think there's some fun learnings to come out of it. One is the advantage of the loose coupling around a credential. I thought that was really interesting. Having worked for 10 years in the medical world, knowing how complex integrations are, by being able to put this in a verifiable credential, you remove the direct coupling. Gus may have thought it was complex doing it the way with verifiable credentials, but he's not seen the painful integration that might have, with a direct integration that would have been required had the direct integration been required between.
Yeah, no, and I'll clarify that, Ken. It wasn't that the technology was complex in itself. Actually, that part was quite simple. It was it was the orchestration of the people and processes and getting agreement on that, and going, and getting all of the checks and balances completed. It was more of the the technology part was quite simple, actually. We always had confidence that it would work, but it was more of it was more the orchestration of all the stakeholders, I think.
And there are quite a few stakeholders involved: the medical side, the government health side, the air travel side, the venue side, and I think it was quite a challenge to bring all of the parties together and get agreement on what should be done and how to do it, and to check all the legal check boxes as well.
And I think that's a really good thread to pick up on, because I was in Aruba with Gus, and we had the jobs of going to the verifier venues and explaining this brand new technology, in the sense of, I think all of us here in this meetup are familiar with decentralized identity. But when you're running a tourism venue, you may not be up to date on everything that's going on in the tech world. And so we were the ones that were going in for the very first time and saying to business owners, here's this technology, here's how it differs from what we experience today. Here's the opportunity to help us prove this technology and get their buy-in, get their approval. They had to dedicate staff and time to this trial project and support us. And what I want to play now, Gus, is the video that we, not this video, but the video that we shot in Aruba, we were able to interview some of the venues who participated. And so I think it's a good time to watch this video that goes over the entire experience down on the island.
We are using technology applied to digital identity. So what we see with this trial with Ceta is that we can issue that trusted traveler credential even before flying. And this credential, which is safe and verifiable, can be reused across the whole travel journey, even at hotels, restaurants, shops, or nightclubs. So this is another step in Ceta developing a more durable and a safer travel credential that will combine all travel documents, such as passport information, health information, and visa.
Right now, we have very strict rules. Our colleagues of the Department of Healthcare, they will be monitoring and controlling all the reports and results from labs coming from abroad. And if the passenger doesn't have the required documents, they will come through us.
Making use of technology to attract more tourists to the island. Our Aruba Health App platform, and the platform where tourists could upload their PCR testing could have been verified remotely. We could give the tourists also the security. When they come to the island, they will be treated as secure and safe, and also we could ensure safety and security to our people on the island.
So the number one challenge was making sure about the health and safety of the customers, but also the guests. Where it's crucial that we know that everyone that's coming into the casino is checked or is verified by the government. So we know we can, with confidence, say welcome the people and have an assurance that they're checked. The government has their checks and balances in terms of vaccinations and or with the PCR test in this case, and not having to worry about tracking that from our side, from operational perspective, is great.
Well, the overriding challenge for all of us really has been safety and well-being of our visitors and safety and well-being of our brilliant staff. It's a very interactive place, so there's kind of a lot of logistics and protocols to think about. Without technology and technology like this, things become very strenuous, tedious, and off-putting, and I think lead to lack of cooperation and other things that undermine health and safety.
Making sure that my health information above all is secure is really important. And so knowing that I'm not having to give away that information to numerous different companies is really crucial to me feeling safe about having that information in an app like this.
Privacy is our next to care, our second goal. Of course, everybody has to feel safe in our hospital, and that's the same structure that we want to maintain within our facility, especially here at the airport.
Key benefits of this project to Aruba is to ensure great positive experience to the tourist that is traveling to the island.
As soon as we heard about the project, we were willing to cooperate on the system side of it because we want to give our contribution to getting back to normal.
So, Gus, when you saw this video completed for the first time, what was your first thought based on the work that you put into the project?
I think without coaching anybody, that they conveyed exactly what we were trying to achieve.
Yeah.
I think so they got it. Was a great relief.
I think from being involved and listening to a number of the exit interviews with participants, we've been so involved in this space for so long. In one way, we are numb to the impact it makes in people's lives, and the amount of emotion that came out in the participants during their exit interviews really caught me off guard. The impact that they felt in their daily life, in their business, in resuming back to normal, and it was really powerful, and that the feelings they conveyed in those exit interviews still sticks with me today as I continue to work on this technology. I want to ask Ken, for all those here. Ken supported us from home base. He was helping lead the tech team for those of us who were on the island running the actual trial. Ken, this might have been the first time you saw this video. What are your thoughts?
I was impressed by the people's positive experience with this. This isn't in a trial state, and so it's not the completely polished product that a full system would have in it. But compared with the complicated mechanisms that it's replacing, it does take the user experience up a notch in being able to travel and present their documents in a quick and easy way. There are obviously enhancements that could be added to make it even better and faster and more efficient. But I thought that the amount of pain reduction or friction reduction for the businesses in having to track on a piece of paper or in a spreadsheet health information, this reduces burden on those businesses. It reduces burden and anxiety on the part of the travelers as well. So I was very impressed with seeing them in action and being able to participate without too much difficulty.
I want to invite those who are joining us to ask questions, give comments. You can either jump right in or you can raise your hand using the Zoom feature and I will find you as well. We have a raised hand here. I think that's Adrian.
Yes, thank
Yes,
you.
hi, welcome.
Hi. Indeed, this is great work. I mean, it is so incredibly thorough and such a joy to see real world, real world interaction with on all these levels, government, airlines, industry. I'm curious because there's obviously a wide range of security concerns around fraudulent use of everything from yellow vaccine cards to the Excelsior app in New York had some issues raised about it just recently. And all of these things are on this spectrum of security intensiveness. And I'm not talking about privacy. We all agree that the privacy has to be done, by default, let's call it. My specific question in this context is, first of all, am I reading this correctly? In other words, that even after you solve all of the privacy issues, as well as I think you did, there are still choices of how much security are we going to introduce into the system. So much specifically in the video that we just saw, the restaurant verifier is being shown a cell phone by somebody they've never met before. And there is no biometric, or they're not presenting the passport that they used when that credential was created by the issuer, a week ago. And I'm curious if that security aspect is work in progress, or it's not really an issue, or that's my question.
Maybe first we go to Ken and then Gus, if you have thoughts too. So Ken.
Sure.
It is an issue that I think warrants a little bit more enhancement. But during the time available to get the trial ready, there wasn't time to do something like include the passport photo being displayed at the same time as their health status. There's a number of options that you can take to make it more secure and tie it to other credentials that they have or other data that's on the phone that helps bring the biometric aspect into it.
Right. And they needed a biometric in the trial to open the application itself. Gus, I think this is, oh, yes.
Yeah, you're securing the phone pretty well, but the correlation of the phone to the person is the tricky part to say that the credential that I have actually belongs to me and it's not Adrian's credential that I'm presenting to the restaurant to get in. So there's some tying of how does the restaurant owner know that it's me and that that's my phone and that the two are tied together. And so there's some biometrics that tie the phone to the person to provide access, and that's not a tricky integration. Providing something like a photo to share as part of the trusted travel credential might be a nice way to make a identification of the person to a stranger who's doing the verification a little bit more positive.
And in order to register for this app, the user had to scan their passport, et cetera, to use that identity in order to claim their medical record. I think, Gus, this is an interesting thread, is talking about security, especially as you mentioned about putting things in little bottles now, how security has changed and how will security continue to evolve with verifiable credentials.
So the strength on the issuing of the data to the person was stronger than the strength on the verification process at a restaurant, for instance. And so that's an area that could be improved. Gus, what are your thoughts?
Yeah, I mean, I would say in the trial, the phone and the QR codes, that's a proxy for where we're headed. I think ideally, it would be a face pod and even an automated gate of some kind. Those are things that are absolutely doable. We wanted to do them. It's just a timing kind of thing. So we definitely, absolutely have to connect the physical person to ensure that that is the person that's standing, in front of you based on what you're presenting. And we think we can do it. I think it's just something we have to prove out, because that also, anytime you talk about biometrics, that brings a whole nother can of privacy concerns.
And then Adrian, you had a follow-up question, and then we'll go to Maki.
Okay, that's actually not a follow-up. It's about the VCs. It's a totally separate point. Okay. I really appreciated that insight about how moving to verifiable credentials really solved an integration problem that has otherwise plagued healthcare in general for forever. And I'm curious, in the context of health credentials and traveler cards in general, which is obviously your long-term vision, will the WHO, who do you think is going to standardize the schemas? And what does our community now have to do in order to just take care of this? Because it's neither a security nor a privacy problem. It's anybody you would ask basically says, this is just stupid. This is not proprietary. This is not partisan. It's not political. What do you guys, given all of your experience, and this has been your focus, what do you guys think we all should do here about this to benefit from this insight that you clearly have?
Well, maybe Gus can look at this for us from the aviation travel standpoint, and then Ken can dive into the decentralized identity community standards organizations. So Gus?
Yeah, I mean, from my viewpoint, absolutely, there needs to be, a level of standardization. We obviously early on, engaged the likes of the WHOs in the air travel industry. ICAO is the primary regulator when it comes to the ecosystem. Basically, everybody was in crisis mode, particularly in early COVID. So, go away. So, and I think the challenge is just a lot of noise. There's a lot of people claiming a lot of things, and it's hard to stand out there. So our approach was let's get something working, and let's prove that the fundamentals work. And perhaps some of what we've done can just be adopted as a de facto standard, but more importantly is open everybody's eyes in terms of what's really possible here, and what are the real things that have to be standardized, right? Rather than take it from an academic viewpoint and then get a lot of assumptions wrong. We can start to get their attention because we have something working. But also be able to say, this is what you need to solve, what we need to solve for specifically, because we can't really grow this without it. I don't know. Hopefully that answers your question.
There are some good points in there. One of them was let's do something, and we did something. The second is that there are standards bodies who are trying to work this out. Some of them are coming from the medical side, some of them are coming from the decentralized identity side, some of them are coming from government sides around the world. I believe that there will be 5 standards, and then working to try to pull them together is the right idea. Our Cardea system was built on the idea that we would need to be flexible and adapt to both changing schemas and changing medical requirements. So that's built into the system to be quite flexible and adapt to that. We do need to bring the communities together, and as an olive branch in that direction, tomorrow we've invited the Good Health Pass to come present what they've done on schemas thus far and see how we might be able to interoperate with that system. There will be similar efforts need to be made for other organizations who put together their own standards for what the schemas might look like, and pulling those communities together is the correct mechanism to do that. So Paul Knowles will be talking about that tomorrow in our meeting, and he's kind of led some of the effort on schemas and overlays and how to address the medical credential piece of it. But with the fragmentation that does exist and will probably continue to exist for a short period of time, the solution that Ceta has is flexible enough to accommodate multiple credential types into their governance and have it be done in a machine readable way so that the rules can be flexibly adapted to accommodate multiple schema types to address that. We've only addressed our own initial foray into this and need to broaden the number and types of credentials that are accepted. But we'll be looking to other standards organizations and cooperating with them to help make that happen.
Let's go to Maki. Thank you for waiting for us.
Yeah, no problem. Thank you for letting me ask a question. And first, let me say that congratulations to everyone that worked on this. It looks beautiful and very impressive. My questions are mostly around what kind of budget did you have to work with, and actually who paid for what got done.
I think I'll turn that over to Gus.
I don't remember exactly the total figure. Probably we're still counting for expense reports, but I mean, it wasn't astronomical for sure. The lab, we have a very tiny budget. At Ceta, we're not IBM research or something like that. So it was definitely something achievable. I think, we do try to keep things, what's the simplest thing that's going to prove the idea. So we try not to over-engineer. One of the reasons why, we didn't necessarily, look at full-blown a biometric gate or something like that. What was the second question again?
And who actually, where did the money come from? Who paid for this?
Yeah, this came out of the lab budget. So this is this came out of my budget.
Okay, your organization, not Linux Foundations or anything else, or not the government.
Right.
The Linux Foundation contribution by Ceta happened after the trial had occurred. So this was an innovation that Ceta took on their own. The fact that they're trying to help establish a community around this is a second step in the process.
Yeah, I mean, I think, maybe to give you some background, right? So Ceta is owned by the air transport industry. Our owners are airports, airlines. So we have a community function, right? And we have some nonprofit, kinds of functions within Ceta to keep the industry operational. The lab, we play to that community function. The way we operate is we engage stakeholders to address issues that are maybe bigger than any one airline can address. We fund that, out of our budget. And what we look, the kinds of investment we look for with the communities that we work with is the subject matter expertise, the requirements, and any assets that they have, whether it's people, technology, to actually prove the trial and get their validation at the end of that we actually proved the hypothesis that we were trying to prove. So we're not a cost center in that sense. We really approached Aruba as we want to collaborate with you on how to address this problem. So that's how we operate in the Ceta lab.
That's excellent. Thank you so much. That background was very helpful.
Are there any other questions that we have? I'm checking the chat here. Jim, did you have any follow-up to your questions in chat? I don't hear any, and I think we got Michael. We took your questions in chat. Did you have any follow-ups? I think we I think we have answered all the questions. And so maybe what we'll do is we'll wrap up our time here together. Gus, I'll first turn it over to you for parting thoughts and words. Let me turn that off. That was a little stinger to take you out of the session there. So yes, you're now that we've reached this point, we worked so hard, focused, laser focused on the ground. We definitely earned our dinner each night when we were implementing the trial. Now that we've gotten to this point where we've actually had a couple weeks to take a breath, what are you thinking?
Yeah, so I guess we still have a mountain to climb in terms of getting people comfortable with the new technology, and and growing the ecosystem around this. We learned a lot. I mean, there are holes in the or complexities, I would say, in some of the elements of this on the technical side that need to be addressed. There's questions like was mentioned earlier about assuring the individual is really connected to that credential. There are lots of things that we need to, as a community, to grow it and get really focused on the things that are going to put forth confidence in getting getting this adopted at a broader scale. There are many people that still think, well, I'm just going to stick all this data in a database and be the broker for it, and that's just the easiest way to go. So, decentralized model, it's a little bit harder because it's harder to understand. So we just need to join in and let's create a hit list of things that need to improve, or where we go next, and let's get on that.
And Ken, what are your closing thoughts?
Once you have a proof of concept or a trial that's been successful, there are a number of things that need to be evaluated both on the technical and business side to make sure that you have a successful product launch. Our network and agents are in pretty good shape. The applications, getting them deployable in application stores so that they're more readily acceptable and accessible to the end users. There are different ecosystems that will spring up around this. One of them, the one that Ceta has put together around air travel, is one. There might be others that might be focused on particular businesses, like running a factory and making sure that your healthcare workers are safe and secure there as well. That doesn't really, that's not Ceta's cup of tea. It's more of another application of similar technology, but they can all benefit from the interoperability of the medical credentials and the mechanisms for transmitting them. On the business side, we have to make sure that the governance is in place. That applies both at the network layer. The Indicio network has good governance there. But the architectural review and design, there are some enhancements such that Gus mentioned about identifying the person with the phone that they're using, things like that, to enhance the security and best practices there. There's obvious enhancements that we can do on, even though this was usable, there are improvements to UI and UX that need to occur, and then launch strategies to communicate the value to people as it might be adopted more broadly in a beyond a trial. So all of those things go into the successful launch of an ecosystem. And I think that having a roadmap that says that we can address those issues in a meaningful way as a community makes it more likely that we will have success and that we'll have broad adoption.
Well, I want to thank you, Gus and Ken, for talking with us today. What I'm going to do is turn it over to Maya to close this out.
Thank you, Heather, Gus, Ken. It was an amazing discussion. Heather, could you go to the next slide at the end? One more.
That's the last slide I have.
Okay. Okay. So we have a next meeting. Oh, that one. Yes. So our next meetup is June 23rd. We will be talking about open source by Ford, digital wallet, interoperability, UI UX with James Evert. So we are very looking forward to seeing you again. And thank you for coming, everyone. And have a wonderful day. Bye, everyone.
Bye. Thank you.
Thank you.